Infection and transmission is the next topic. Now, for infection principles, the pathophysiology of infection and key terms to know, first is incubation. This is the time of exposure to an infectious agent until the onset of symptoms. So viral or bacterial particles replicate during this incubation stage. The next key term is prodromal. The infection agent continues replicating, which triggers the body's immune response, and mild and nonspecific symptoms occur. This is the infectious stage. Now, the third key term is acute. This is the time when the person shows apparent or major signs and symptoms, also known as manifestations. Now, for local signs of infection, we see pain, swelling, redness, warmth, and exudates, which is body fluid that oozes out or is discharged from tissues during inflammation. So purulent exudate is from bacterial infections, and serious exudate is typically from viral infections. Now moving on to systemic signs, or total body signs. We see fever, fatigue, body aches, headache, and nausea. Okay, switching gears to the top tested key terms for the modes of transmission. The first key term is vector. This is where an insect or animal is the carrier host. A great example is contraction of the West Nile virus via a mosquito bite. So the memory trick, just think vector is the West Nile virus, since it's carried by this mosquito. The next key term is aerosol. These are small particles from the respiratory tract that travel airborne for aerosol. So airborne transmission because droplets are very small and can travel long distances. A great example is measles, tuberculosis, and varicella, as well as the COVID-19. So the memory trick, just think COVID, think cove air, since it travels airborne. And the next key term here is droplets. Respiratory or saliva expelled from an infected individual. Examples are pertussis, influenza, meningitis, and pneumonia. And lastly is direct contact. There's no intermediary host here. It's spread via touching an infectious lesion or direct contact with blood or body secretions. Great examples are HIV, herpes, and hepatitis. So the memory trick, think of the H and just say contact. It kind of sounds like a bunch of H's for contact, right? Okay, now for the top memory tricks for the top tested droplet and airborne precautions. I know droplet and airborne precautions can get a little confusing. So user memory tricks, PIMP for droplet precautions, and MTV for airborne precautions. So just think you're on air with MTV, like music television. And think of Pimp My Ride, like that old TV show, when you're dropping your lowrider really low. So for droplet precautions, P is for pertussis, I is for influenza, that normal flu every year, M is for meningitis, specifically bacterial, and P is for pneumonia, basically pneumonia. And for airborne precautions, M is for measles, T is for TB tuberculosis, and V is for varicella. Now, a lot of test questions come from PPE here, so write this down. For droplet precautions, number 1 is surgical mask and goggles, and number 2 is a single room. Now, ATI mentioned that we teach unlicensed personnel to wear a mask. And for airborne precautions, the number 1 thing is staff must wear N95 masks. The patient has to be in a negative pressure room, the door must be closed, and here is a tricky one, write this down. When you're transporting the patient must wear a surgical mask. Now, a few different textbooks had different things to say about this, but overall, surgical mask was the most recommended when a patient leaves the room. So guys, write that down. Not N95, but surgical mask. Now, a little side note here. Don't let the NCLEX trick you here with those fundamental questions when you're putting on and taking off PPE. So when you put on or don PPE, just think the gown goes first, the mask second, goggles, and then lastly gloves. And it's almost the exact opposite
when you're taking off or doffing. Gloves are first, then the goggles, and here's the tricky one, the gown third, and then lastly, the mask fourth. Now for the top 2 missed questions from this section. Question number 1. A patient presents to urgent care 48 hours after a tuberculin skin test. The site looks red and raised with a 19 millimeter induration. The nurse knows which of the following. Select all that apply. Okay, now before we look at the options, from the TB video, you know that TB is an airborne infectious disease. And anything over 15 millimeters is positive for TB infection. Now the real question is this. Is the TB active or inactive, aka latent? So we definitely do a chest x-ray to confirm the status, or 3 early morning sputum samples on 3 consecutive days. So option number 1, anticipate orders for a chest x-ray or sputum samples. Yes, we have to confirm if the TB is active or inactive. Now option number 2, this one's a little bit tricky here. Collect blood for a quantiferon TB test. Now you're probably asking yourself, what the heck is that? Well, this test can actually be used for an alternation of a TB skin test, but in practice, we typically do an x-ray or a sputum test first. Now, option number 3, the patient has active tuberculosis. No, this option is incorrect because we don't even know if it's active or inactive. That's why we have to do option number 1, all these tests to confirm that. Now, option number 4, the patient has a tuberculosis infection. Yes, this is true. So write this down, guys. The body has developed antibodies and shows presence of TB. But again, even though the patient is infected, it doesn't mean that the patient is contagious. Only active TB is contagious. Now, option number 5, immediately place the patient on droplet precaution. No, we place the patient on airborne precaution. And it's only done for active TB patients, and the patient's not really confirmed for active form yet. But this option is wrong because, again, TB is airborne precautions and not droplet. Now, question 2, when caring for a patient with bacterial meningococcal meningitis, the nurse implements which of the following? Select all that apply. Okay, the key word here is meningitis. So before looking at the options, what do you know about meningitis? Well, meningitis is the inflammation of the meninges, right? It's an infection. So any head inflammation can lead to increased ICP. So we want to make sure to keep the lights and noise low, as well as watch for seizures. And meningitis is highly contagious, especially bacterial, requiring droplet precautions. So remember the M in our acronym PIMP stands for meningitis. And only surgical mask and goggles, not an N95. So surgical mask is required here, as well as a single room and not a negative pressure room. So option number 1, advise the unlicensed personnel to wear a surgical mask. Yes, the key term there is surgical mask, not N95. Now option 2, implement padded side rails. Yes, seizure precautions, especially for that increased ICP, which is very common with meningitis, that infection inside the meninges. Now option 3, keep the light and noise low in the room. Yes, once again, for that increased ICP risk. And option 4 and 5 are incorrect. Place the patient on a negative pressure room. No, this is only done for airborne and not for droplet. And put the patient on an N95 mask before entering the room. No, again, this is only for airborne. For droplet, we use that surgical mask as well as the goggles. All right, that wraps it up. Thank you so much for watching. Don't forget to take your
It's that time again, the practice questions on infection and transmission. So question number 1. A client with a new diagnosis of West Nile virus asks the nurse how the disease is transmitted. How does the nurse respond? So pause the screen and take a moment to figure it out. Okay, let's break this question down. So always look at the key words in the question first, and then think of a few things you know about that. So West Nile virus, this is transmitted via vector, insect or animal carrier host. So an example again, contraction of West Nile virus via mosquito bite. So the memory trick is the V for vector. Think of the V, West Nile virus. So let's look at our options here. Option A, the West Nile virus is transmitted via direct contact with blood or bodily fluids. No, this is true of HIV and even herpes with that direct contact. Now, option B, West Nile virus is transmitted via large droplets. No, remember, droplets is PIMP, pertussis, influenza, meningitis, and pneumonia, not West Nile virus. And option C, West Nile virus is transmitted in tiny airborne particles. No, remember, on air with MTV, measles, TB, tuberculosis, and varicella for MTV. Now, option D is the most correct. West Nile virus is transmitted via vector who carry the infection from one person to another. Yes, remember the memory trick. V for vector, V for West Nile virus. Now, moving on to question 2, which is an example of a disease that is spread via droplets from an infected individual? So pause the screen and try your best to break this question down. All right, let's break it down. Always focus on the key words here before looking at the options. So the key word is disease that spread via droplets. So remember, droplet is that PIMP. So P for pertussis, I for influenza, M for meningitis, and P for pneumonia. Now let's look at the options. Option A, influenza is the most correct. Remember, the I in PIMP is for influenza. It's spread via droplet. Now, option B is incorrect because hepatitis C is not spread via droplet. So remember, the C in hepatitis C is from contact with blood of the infected person, so it cannot be spread via droplet. Now, options C and D are also incorrect because varicella, even though it's very close, this one is actually spread via airborne. So remember, be on air with MTV. The V is for varicella. And option D, HIV, remember the H's are for contact precautions and not for droplet. Now, moving on to question number 3. The nurse is conducting teaching on preventing the spread of COVID-19. What does the nurse include in the teaching? Oh snap, it's a COVID question. So go ahead and pause the screen and try your best to answer this question. Now, before looking at the options, always think of 1 or 2 things you know about those key terms. So the memory trick, think of COVID as cove air. Think airborne transmission. So let's look at the options here. Option A, COVID-19 is only spread when in very close contact with an infected individual. That's 6 feet apart, right? Actually, no. Watch out for those key terms. Only. So only spread with very close contact. This option says nothing about airborne, so it's wrong. Now, option B, preventing the spread of COVID-19 only requires the use of universal precautions. No, once again, the question says nothing about airborne precautions like an N95 mask. Universal precautions is not specific enough to be correct. Now, option C, COVID-19 is a bloodborne illness. No, remember, direct contact is that HIV, herpes, and hepatitis C for contact precautions. Now, option D, COVID-19 is present in tiny air particles. Yes, the key term there is air particles that are easily spread long distances in droplets from an infected individual. Yes, now this option is the most correct. Once again, the key term here is air particles. Even though the question can be confusing by stating droplets, it's still spread via airborne route from tiny airborne particles.
All right, that wraps it up. Thank you so much. Now for influenza. This is often called the flu for short, in influenza.
Now, this is an infectious disease caused by the influenza virus. So it's not a bacteria. Therefore, antibiotics will not work. So please be sure to write that down. Not a bacteria, so no antibiotics. Now, I know we're going to cover that later in the pharmacology area, and we're only doing patho right now. But just know that viruses are totally different than bacteria. Now, for types of influenza, we have A, B, and C, and it's constantly mutating. That's why every single year a new flu shot is needed to protect against new viruses. So again, annual vaccinations are recommended. Now, in terms of manifestations or signs and symptoms, it's common flu-like symptoms. So fever, fatigue, and body aches. All the symptoms can range from mild to moderate to very severe.
All right, that wraps it up. Thank you so much. Pneumonia is a nasty infection causing severe inflammation in the lungs and causing the alveoli to fill with mucus, fluid, and debris. Now, this extra fluid can make it harder to breathe. So the memory trick, just think P for pneumonia as P for a plague of inflammation inside the lungs that fills the alveoli with fluid. As you know, the alveoli is the place where gas exchange occurs. So normally we breathe oxygen in and carbon dioxide out. But with pneumonia, all this fluid, mucus, and debris fills the lungs and leads to impaired gas exchange, where CO2 can't get out and oxygen can't get in. This results in hypoxia from that low oxygen and acidosis from too much carbon dioxide. So just think carbon diacid, since too much CO2 can put the body into acidosis, and also impaired ventilation, as the body tries desperately to get air through those fluid, mucus-filled alveoli. So write it down. Impaired gas exchange is typically the most tested nursing diagnosis for clients with pneumonia, which leads to ineffective breathing pattern as the body fights for air. Now for the signs and symptoms, before you start memorizing, just think of the patho here. Again, P for pneumonia, just think P for a plague of infection inside the lungs. Now write down these top 6 most tested key terms here. Number 1 is altered mental status. We see restlessness, agitation, and confusion. These 3 are the earliest signs of hypoxia. So write them down because they are critical, since it can lead to deadly respiratory failure. Now the brain is very sensitive to oxygen. So these key words also cross over for other conditions where we have low oxygen in the brain, like increased ICP and even strokes. Now, number 2 is fever. Key term here, over 100.4 or 38 degrees Celsius. Always an NCLEX favorite, and that loves to show up on exams. Number 3 is a productive cough with yellow sputum from that infection. So again, pneumonia, just think that plague inside the lungs, which leads to number 4, fine or coarse crackles upon auscultation from fluid and mucus-filled lungs. And then number 5, dyspnea, that shortness of breath. Okay, now the biggest sign that pneumonia is getting worse is key term pleuritic chest pain with pleural friction rub. That must be reported to the HCP. It's described as a sharp chest pain upon inspiration or breathing in or upon coughing. Now, sometimes it's described as stabbing or burning pain inside the chest that increases upon inspiration or with the cough. Pleurisy is a major complication of pneumonia, as inflamed lung tissues rub together, sounding kind of like rocks rubbing together. So we call it pebble friction rub for pleural friction rub, or even sounding like sandpaper rubbing together, kind of like this. So Kaplan mentions, a pleural friction rub is described as a gradient sound or vibrations heard during inspiration and expiration. Now other signs, which are not really key, include unequal chest expansion, bronchial breath sounds, which are high-pitched sounds, and tactile fermentitis, This presents as more vibrations from a patient's back when repeating certain phrases and indicates denser or inflamed lung tissue. Now, a common NCLEX question here. A priority patient of who to see first. So a postoperative patient with suspected pneumonia with a normal temperature and an SpO2 of 94%. Becoming, key term here, restless and agitated. So remember, the key terms there for hypoxia, restless and agitated, definitely mental status change. So anytime you see the word post-op or post-operative, you must think the worst case scenario for priority patients is acute respiratory failure, even if the temperature is not elevated and the oxygen saturation is not drastically low. So just look for the key terms, restless and agitated. Now, don't let the NCLEX trick you here on select all that apply questions. Pneumonia does not include tracheal deviation. That's typically from tension pneumothorax. And it doesn't include hyperresonance, which is typical for a regular pneumothorax, that air inside the pleural space. And it's not dull resonance, which is typical for a hemothorax, that blood inside the pleural space. But it can also happen in fluid-filled spaces too, like a pleural effusion, a complication of pneumonia, which we'll get into next. So the memory tricks, think T for tracheal movement as T for tension pneumothorax. And the L's for dull resonance, think blood or fluid for hemothorax or pleural effusion. And then the H for hyperresonance, just think high air.
Okay, now for some key terms that you must know for your pathophysiology course. The main types of pneumonia. First up is lobar pneumonia. This is described as an infection of one or more lobes of the lung. Now, it's caused by Streptococcus pneumoniae bacteria, and a big complication is pleural emphyema. This is a collection of pus in the pleural cavity, where bacteria migrates and creates sort of a fluid-filled lung. It's one of the various kinds of pleural effusion, which we call pleural effluid, that fluid in the lung, which we'll cover in great detail in a moment. Now, in terms of manifestations and signs and symptoms, you should be sure to write this down. Number 1, lobar pneumonia has a sudden onset. And number 2, we hear ralls or rails, and described as crackles. This abnormal breath sound results from rumbling mucus within the lower airways, indicating that there's fluid inside the lungs. Described as a small clicking, bubbling, or even rattling sound. So we typically say rattling for ralls. And number 3, a big key term here, is rusty colored sputum caused by exudates. Now, it's just nasty lung butter that you would normally expect with any lung infection. It's basically pus-like sputum. Now, to get deeper into the patho here, it is due to the presence of RBCs, those red blood cells, and WBCs, those white blood cells, which get caught up in fighting infection. Now, moving on to bronchopneumonia. This is a diffuse infection in both lungs. The key term here is both lungs. And this is the key difference from that of lobar pneumonia. So the memory trick, think B for bronchopneumonia as B for both lungs affected. Now for the causes, there's several different microorganisms here that cause this bronchopneumonia. And the key manifestation or sign and symptom is yellow or green sputum with a productive cough. So clients with bronchopneumonia present with this green-yellow colored sputum due to the presence of multiple microorganisms affecting the lungs here.
Now for the critical complications, these are priority for the NCLEX here. So pleural effusion, just think pleural effluid. We see fluid that fills the pleural space, that space between the lung itself and the chest wall. Now this prevents full lung expansion, resulting in decreased gas exchange, so we get less oxygen in and less CO2 out. And this increased CO2 pushes the body into acidosis. So the key signs to write down are the 4 Ds. D for during inhalation, we see chest pain. D for dyspnea, that shortness of breath, D for diminished breath sounds upon auscultation, and then D for dull resonance on percussion. Remember, fluid-filled is dull, so don't let the NCLEX trick you here. It's not hyperresonance, as that's high air trapping. Now write down these 4 because these key signs came up a few times on Select All That Apply questions. Now the priority intervention for a pleural effusion is a thoracentesis to drain that fluid. The provider will stick a big huge needle into the lung itself to drain that lung fluid. So a big complication is a popped lung or a pneumothorax, where air accumulates inside the lung space. Or even a hemothorax, where blood accumulates inside the lung cavity. So it's priority to report asymmetrical chest expansion and decreased breath sounds, 2 big key terms for thoracentesis. Lastly, the most deadly complication is ARDS, acute respiratory distress syndrome. We're talking deadly stiff lungs. So just think ARDS, we have hard lungs. And the key signs include, write this down, refractory hypoxemia. We're talking low PaO2, despite increased oxygen delivery. So the memory trick, just think the body is resistant to oxygen with refractory hypoxemia. And again, the first signs of low O2 is that altered mental status. And the top 3 again, number 1 is confusion, number 2, agitation, and a big one for number 3 is restlessness. Now we cover ARDS in its own full video, but again, these are the priority highly tested key terms. Now another complication is septic shock. This can occur if infection gets severe, as the body releases chemicals into the bloodstream to fight the infection. In result, the total body becomes inflamed, which can damage multiple organs within the body itself, causing them to fail. And this is known as MODS, multiple organ dysfunction syndrome. Naturally, we see cardiovascular collapse with low blood pressure and low perfusion, that low oxygen. So the memory trick, just think S for shock as S for severely low blood pressure and perfusion. So the key signs to know for septic shock is hypotension. The key numbers here is systolic blood pressure below 90 and MAP, that mean arterial pressure, below 65. Anytime these numbers get low, we know we gotta go. Go seek help from the primary care provider and report these findings. So write that down, huge NCLEX tip. Now some other findings is a cap refill over 3 to 4 seconds, tachycardia, and early signs we'll see a fever over 100.4 as the body fights the infection. Now a late sign is hypothermia under 96.8. As shock worsens, we get more severely low blood pressure and worsened perfusion. So the core body temperature goes down. And we also see elevated WBCs and decreased urinary output. And the key to know for this is 30 mLs per hour or less typically means the kidneys are in distress. Now write these down. We cover it more in the full video for septic shock, but these are the most tested signs and always love to show up on Select All That Apply questions. Now in terms of risk factors and causes, the greatest risk factor for pneumonia, number 1, write it down, is advanced age. And the key number used on most exams is over 65 years old. Now, common exam questions love to give scenarios about an elderly population getting a respiratory tract infection or even the common flu that develops into pneumonia. This is called community-acquired pneumonia, since it was caught inside the community. Now, don't let the NCLEX trick you here. Environmental exposures are not the greatest risk factor than advanced age here for pneumonia. And neither is nutritional deficit or even obesity. So always think here, advanced age over the key number, 65 years old, is the number 1 risk factor for pneumonia. Now another highly tested cause is for clients on ventilators who get VAP, ventilator-associated pneumonia. This happens when secretions in the mouth and throat contain bacteria that cause pneumonia. So it's critical to, number 1, reposition the client side to side every 2 hours. This helps to mobilize secretions. We do oral care and suctioning, again, every 2 hours, with chlorhexidine. These 3 key points are always on Select All that apply questions for VAP. Now, the best indicators for VAP is, write it down, positive sputum culture and fever, and we also saw chest x-ray with new infiltrates. Now, don't let the NCLEX trick you here. Not lung sounds and not blood cultures. The best indicators here are diagnostics for VAP. Now, in general, prolonged immobility is another huge risk factor, since secretions are not mobilized and then get stuck in the body, as well as chronic diseases like COPD and clients who are immunosuppressed. But really a big one here is post-operative, or in other words, clients who have recently been out of surgery. We basically put the body to sleep with anesthesia, making the lungs low and slow. And now the alveoli are low and slow, or sleepy too. So we need to re-expand them to prevent collapse, that atelectasis, and prevent infection from settling in and getting trapped there. That's why we always turn, cough, and deep breathe, and always early ambulation after surgery, as well as use of the incentive spirometer to re-expand those closed alveoli. So a common exam question asks for the best indicator for VAP, that ventilator-associated pneumonia. And again, the best indicator is positive sputum culture. So once again, it's not elevated WBCs, and it's not even those blood cultures. So yes, those might be present too, but again, the best indicator for diagnosing VAP was the key term positive sputum culture. So write that down. Now, speaking of diagnostics, we can always do a chest x-ray that shows infiltrates. We're going to see elevated WBCs, that white blood cell count, over 10,000. And once again, a sputum culture will be positive. So a big test tip here. Cultures are always taken first before starting antibiotics. So just think of the double A's. A for antibiotics are given after cultures are taken. This is done to better identify the organism causing the problem so we can choose the best drug to kill it. And another common exam question here. The best blood lab value shows effective treatment of pneumonia after IV antibiotics. And the key term was white blood cell count. So for this particular question, it's not a sputum culture and it's not lung sounds. This question asks for a lab value for the key term after IV antibiotics. This will reflect a killing off of the infection inside the blood. So the best lab value reflects a decrease in WBCs, meaning a decrease in the army or defenses the body needs to fight the infection, since the antibiotics kill the enemy invaders. All right, that wraps it up. Thank you so Now for tuberculosis. It's a bacterial infection in the lungs caused by bacteria called M. tuberculosis. It's spread via the airborne route. So once inhaled, it spreads to the lymph and bloodstream. Naturally, this alerts the police of the body, the WBCs, our white blood cells, which I call the WBC Elite Squad, Septic Victims Unit. They respond by kicking out the infection to protect the body from invaders. So naturally, plasma B cells of the WBC squad come flying in to help identify the invaders. Like, we identified the foreign invaders. Engage. They shoot up the invaders with little name tags called antibodies, sort of like spraying them with identification trackers. These little antibodies help the killer cells, the macrophages and T lymphocytes, to properly identify the infection. So the macrophages typically gobble up the bad guys, kind of like a chubby cop. They love eating up every bad thing. They say, hey guys, I'm just here, to gobble up stuff. Yeah, give them to me. And the killer T cells, also called the T lymphocytes, or natural-born killers, my favorite name, but we call him the Mr. T cell from the A squad, who says, I pity the fool who invades the body. Now, all these guys work together to try and kill TB, but can't. So they end up quarantining the TB infection into a little granuloma prison, which prevents the TB infection from spreading. Now, this shows up as a little circular dot on a chest x-ray, which helps with the diagnosis of TB. But a little side note here. If a client has decreased immune system or is on immunosuppressants with a suppressed immune system, they will have less WBCs to fight, so less macrophages and less T cells, resulting in our little granuloma dot not being there, which we'll cover in a moment. Now for the signs and symptoms, these are the key points for the NCLEX and your nursing exams. I would write these down. Number 1 is night sweats. Number 2 is anorexia, or that weight loss. And third, a big one here, is cough and hemoptysis, or basically that blood-tinged sputum. That's probably the biggest NCLEX tip right there. I would write that one down. And next, dyspnea and that shortness of breath, as well as fever and chills. So the memory trick to help you remember this, think TB. T for that terrible cough, specifically key term blood-tinged cough, and B for bad infection, including fever, night sweats, and a really big one here, weight loss. So I'd recommend pausing the screen and writing these down. These key terms love to show up on exams and boards. Now, as mentioned before, TB spreads via the airborne route, so it's priority to ensure that airborne precautions are to be put in place if the patient is suspected to have TB. So use these next memory tricks to help you on your exams. I know droplet and airborne precautions can get a little confusing. So use our memory tricks PIMP for droplet precautions and MTV for airborne precautions. So just think you're on air with MTV, like music television. And think of Pimp My Ride, like that old TV show, when you're dropping your lowrider really low. So for droplet precautions, P is for pertussis, I is for influenza, that normal flu every year, M is for meningitis, specifically bacterial, and P is for pneumonia, basically pneumonia. And for airborne precautions, M is for measles, T is for TB tuberculosis, and V is for varicella. Now, a lot of test questions come from PPE here, so write this down. For droplet precautions, number 1 is surgical mask and goggles, and number 2 is a single room. Now, ATI mentioned that we teach unlicensed personnel to wear a mask. Infection, but the key here is that they may or may not be in active form. Most students get this wrong. So the most accurate description of a positive tuberculin skin test is that yes, the patient has TB infection, but additional testing is needed to see if the TB is in active form. Typically, patients with active TB will show those active signs, like that terrible cough and active fever, as well as those night sweats and weight loss. And in latent TB infections, or those who have had the vaccine, will always show a positive infection, or basically positive TST, that red raised bump, since they've developed antibodies to that TB. Therefore, a chest x-ray is always done to rule out active TB, as well as sputum culture tests. So the key point to write down here is for a sputum culture diagnosis. Key terms is early morning sterile sputum specimen, 3 consecutive days. Not a blood test here. Many students get this wrong. So again, if the patient is suspected to have active TB and has a positive skin TB test, then 3 early morning sputum specimens are taken to confirm the diagnosis of active TB. Now, Hesse mentions this. The most accurate description of tuberculosis is most people who become infected with the TB organism do not progress to active disease. And Kaplan mentions the route of administration for a Manu test is intradermal. Now, a little side note, as mentioned before, clients who have a low immune system, like the elderly or even those on immunosuppressants or immunocompromised, they will lack the immune response, typically showing a very small in duration. Now lastly, ATI mentions a few key points. Sputum cultures are taken until 3 negative cultures. The key number there is 3, so just think 3 and you're free. And family members should be tested for TB. These 2 key points love to come up on exams as well as the NCLEX. So to help you here, let's cover the top 5 NCLEX tips as well as TB pharmacology. First is meds last 6 to 12 months. Guys, it's a long duration. Second is N95 mask is worn at all times. Third is that the family is tested for TB. Number 4 is sputum samples are done every 2 to 4 weeks. And number 5, 3 negative cultures on 3 different days means that you're no longer infectious. Guys, not 1 negative culture. The key number here is 3, and then you're free. All right, guys, that wraps it up for this segment. Don't forget to take your quiz and download the study guides.